how will you pay for healthcare research, hospitals, being a doctor, I know you're very caring about this, healthcare for the young and the old, nursing homes, healthcare in general. And charity definitely will not work for all this because when you're 7 years old or when you're 18 years old, you definitely don't have the savings, and perhaps your parents may not have the savings to put into this as well. So research obviously is important, so how would you answer that?
Well, how do you pay for medical care? And it's very expensive. It's very expensive because the government's been involved. Before 1965, government wasn't involved, and I was in the practice of medicine back then and worked in a charity hospital. And office calls were $5, $7, and people come to a charity hospital. If you didn't have money, you weren't charged. So since government's been involved, they've done a few things. The quality has gone down. The responsibility of the patient has been removed because a third party pays. The doctor, the hospitals, and the laboratories, everybody charges the maximum instead of the minimum. So the whole thing has been turned on its head. But your question is, how do you pay for it? Well, in a free society, I can talk about it in an ideal way. In a free society, we pay for it. Would that take care of everything? No. Would it be better than we have today? Absolutely better today because more people are suffering. Now today, you have, you know, the more the government gets involved, the more you need more government. And there is a saying, if a government creates one regulation for anything, it creates a need for two more. In medicine, that has been the case. Because now what happens is the cost goes up and the government delivers the service, and guess who's the most powerful people in the medical system now today? It's the lobbyists. And sometimes we get careless and say, oh, Obama's a socialist, he wants socialized medicine. He really doesn't. He wants corporate medicine, just like a lot of the Republicans want it. Corporations run it. So it's the drug companies, it's the insurance companies, it's the health management companies, and they come and they get to write the laws where they make, you know, the money, but the patient gets shortchanged. And now the whole goal of Obamacare is to destroy private practice medicine. It's pretty blunt there. How would you pay for it? Well, first is she wants to know how to pay for it. Well, you would pay for it like you pay, you know, in the free market, how you pay for your house, how you pay for your food, how you pay for any services. But your concern is because it costs so much. It is only in medicine where technology has not lowered the cost. Because of the government and because of this and this third-party payment that happens. If you were worried about buying a cell phone, what if the government was in charge of cell phones? There was only one cell phone company. Do you think the quality would get better? No, the price would go up and there would be shortages. It would be a mess. So there wasn't a problem. When I was growing up, my dad didn't have insurance. Well, he did. He had insurance for surgeries, you know, major events. That's insurance. Today, there is no insurance. You have prepaid services. Everybody's treated the same way. And that distorts things. It's sort of like saying, what if you had your car insurance for services and gasoline? Well, what if you had a real big car that burned, got 12 miles to a gallon and you used it a whole lot, and you had to, it was all socialized in the sense that you got that paid for by the government. It doesn't work. You have to have insurance paying for the risk. So the prices would go down. Now the solution for some of this to pay for it is to have these medical savings accounts where any individual that wants to, matter of fact, they're available today, but they're trying to phase them out. And you can have a savings account, put $3,000 away in a savings account, and you're a young person, and you don't use it. It just keeps building and building and building. And then if you have to go see a doctor, you pay cash for it. And then that puts, there's a different thing. Doctors and hospitals are unconcerned about it because the government's paying for it, Blue Cross is paying for it. They just say, whatever we can get, we're going to go get it. But if the patient has more control of this, it'll bring prices down. But unfortunately, it's so involved, and now we're going to have shortages of medical care. There will be rationing of medical care. That's what always happens when the government gets involved. So the solution is not the government. Another problem with it on how to pay for this is the lawsuits. Lawsuits are, you know, very, very expensive to all the patients, although maybe only 1 or 2% of the patients might sue. But the suits are so bad, so big, and the doctors have to pay huge amounts. And there's ways to get around that. I have bills in to sort of privatize that, where doctors and the patients can agree to third-party arbitration. And it would be more like what we do with when we have our automobiles. If we have a collision, we don't immediately go to court. We just say, call my insurance company, you know, and they take care of that. But when it's medicine and there's a lawsuit, it involves millions of dollars, and guess what? Guess who makes the most on that? The attorneys make the most of it, and the doctors have to raise their fees. So that's a complication too. But I wouldn't give up on the charity notion, because it's only been since 1965 and that the charities have been undermined. Matter of fact, there's still a burn hospital in Galveston, Texas, part of my district, the Shriner Hospital. And children, it's a children's burn hospital. And if a burn child comes there, they don't have to pay anything if they don't have any money. They take care of everybody. There would be so much more of this because we would be a wealthy society. Today it's a burden because we don't have jobs. We can barely take care of ourselves, let alone say, holy man, if the government didn't pay for my health care, where am I going to get the money? It's a system that is so filed up and we've been so dependent on it. It's also the reason this is coming to an end, because there will be rationing, and we have to work our way out of it. And that's why I say cut. But my program in cutting, matter of fact, has a pretty good transition program, and that is I cut no medical benefits. I don't cut Social Security, and I don't start there. I don't cut child health care. But the only way we can work our way out is you have to be ready to stop all this overseas stuff and stop these senseless wars so that we can provide health care for people.